Hello, and welcome to today's Beyond the Break presentation. My name is Ann Marchetti, and I'm one of the program managers here at the Bone Health and Osteoporosis Foundation. We have a peer educator, Kathleen Camp, here to present the material. But before we get started, I just wanted to point out, number one, this presentation today is being recorded and a follow-up email will be sent about 24 hours after the conclusion of today's event. And if we could ask you, if you have a question, to please go ahead and put those in the Q&A box. That way we can focus on that and we won't miss any of your questions. So it looks like everybody has joined, and I would like to introduce you now to Kathleen Camp.
Thank you, Ann. Well, hello and welcome to the webinar Beyond the Break. My name again is Kathleen Camp, and I'm a trained bone health peer educator. So I want to thank you for joining us today. I also wanted to share that I'm a board certified specialist in geriatric physical therapy, and I've also done some additional training and have some interest in managing osteoporosis, especially with proper exercise and movement and physical activity. I also have the opportunity to serve as the chair of the Bone Health Special Interest Group of the American Physical Therapy Association, which shares evidence-based practice, including resources that are provided with the Bone Health and Osteoporosis Foundation with other of my physical therapy colleagues. So I'm pleased to present this program to you today, but before we start, let's cover just a few housekeeping notes. So if you have any questions as we go along, as Ann mentioned, please use the Q&A feature that you'll find at the bottom of the screen. And to help facilitate this virtual webinar, we have moderators that are behind the scenes. So if you don't receive an immediate response, I will likely address your question at some point during the presentation or the Q&A. If your question's not answered, please contact info@bonehealthandosteoporosis.org. And this webinar, again, as mentioned, is being recorded, and a replay will be sent out again 24 hours after the event's conclusion. So we hope you took the pre-event knowledge survey before today's event, and we appreciate your time to complete the short 5-question survey as well at the end. So we again want to thank you for joining us for the Beyond the Break. And so we'll go to the next slide for our disclaimer. So this is the medical disclaimer slide we are required to read. So please take a moment to review the health-related information on this slide. The medical information we share in this program is provided as an informational resource only, and it's not meant to be used or relied on for any diagnostic or treatment purposes. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. We're unable to answer any personal health-related questions, but please consult with your healthcare provider about any information that you learned today. So today we'll cover information about bone health to help you understand how a broken bone from a low trauma event may be a sign of weakened bones and is a risk factor for more broken bones. Understanding how osteoporosis is diagnosed and how bones change over the lifespan. We'll also cover the risk factors for bone loss and fractures and how medical conditions and medicines impact the bone health. Also, the importance of working with a healthcare provider to have a plan to manage your bone health. Also, what medical specialties can provide help for your bones, and then what you can do to strengthen your bones and prevent additional fractures. So let's start with a story about Angela to illustrate the concept that having a broken bone is a sign of low bone density and the importance of knowing all your risk factors and communicating with your healthcare provider. Angela is 56 years old and recently broke her upper arm after she slipped on a bathroom rug and fell into the door. And when she got up to go, while she got up to go to the bathroom in the middle of the night. But this wasn't Angela's first broken bone. At age 54, Angela had tripped over one of her dogs and broke her wrist when she fell down. She went to urgent care and she had a cast put on and didn't really think much about her broken wrist because it was just one of those accidents that can happen. While it was an annoyance to have a cast on, she was able to keep doing most of the things that she enjoyed and she was able to take care of her family and continue to do her job. Once she got her cast off after 6 weeks, she didn't really think about it again. She didn't think to mention it at her annual checkup with her primary care provider, and her provider didn't ask her if she had broken any bones in the last year. But now, again, 2 years later, she's in a much different situation. Due to the broken upper arm, she is not able to bathe or dress herself because she has lost the ability to use her arm, and she has to rely on her husband and teenage daughter to help her bathe and get dressed. She can't take care of her aging parents who live across town because she can't drive. And now she is unable to do her job that requires both to her to have full use of both arms. This is really having an impact on her day-to-day living. She recently had her annual checkup with her primary care doctor, and because he could see that she had broken a bone, he ordered a bone density test. She just got a voicemail from her healthcare provider that her DEXA showed low bone density, or what we call osteopenia. Angela is concerned because she has broken 2 bones in a matter of 2 years, and she wonders if this is going to keep happening. She questions why her bones are breaking and what she can do about it. If you go back one slide, there you go. So did any part of Angela's story sound familiar? If you've broken a bone from a low trauma accident, such as slipping or something like as far as tripping over something, you may have told yourself, was I just clumsy? It was just an accident, or I wasn't being careful. Breaking a bone, also known as a fracture, from hitting the ground or falling into something from a standing height, is a sign that your bones are weak and that you may have osteoporosis or low bone density. It's not a sign of being clumsy or not being careful. It's a sign that your bones are weak. Having a broken bone or a fracture, other than fingers, toes, and skull, as a result of a low trauma incident may be a sign of low bone density or osteoporosis. A broken bone from a fall may seem insignificant, but it can be an important sign that your bones may not be as strong as they could be. Having one fracture due to weakened bones, which is referred to as a fragility fracture, puts you at a high risk of having another fracture. This risk is especially high in the first 2 years following a fracture. And we know from some data reports that as many as 80% of people who have Medicare that have had at least one fracture related to osteoporosis are not aware nor treated for osteoporosis. Osteoporosis is a chronic disease, and there are many different factors that cause bones to become weak, and that increases your risk for fractures. The good news is that there is much you can do to strengthen your bones and steps you can take to reduce your risk of future fractures. So, what is osteoporosis? When bones lose their mineral density, the structure becomes thin and unable to take normal weight, leaving bones that break easily. It's referred to as a silent disease because often people are not aware they have osteoporosis or low bone density until they break a bone. Healthy bone on the left is strong. It holds up, it protects our internal organs, and when muscles contract and relax, bones help us move around. You can see the osteoporotic bone on the right is thinner and not even connected in some places. This bone will break with very little impact. If you compare the two pictures, you can see why that might happen. Now, take a close look inside the bone and see that it shows something like a honeycomb. When you have osteoporosis, the spaces in this honeycomb grow larger, and the bone that forms the honeycomb gets smaller. The outer shell of your bones also gets thinner, and all of this makes your bones weaker. Osteoporosis is diagnosed by looking at the bone mineral density of your bones with a test called a bone density test, or DEXA. A diagnosis of osteoporosis is made from a score that is determined from the DEXA report. This score is called a T-score. However, fractures can happen at all T-score levels and can be an early indicator of low bone density. We'll cover T-scores and DEXA results later in the presentation. But there are many different factors that cause bones to become weak and that increase your risk for fractures. And today we'll review all factors that increase your fracture risk. So let's start by learning a little bit about our bones. It's easy to think of bone as a hard, lifeless part of our body. But bone is a living, growing tissue, with old bone being removed and replaced with new bone to keep bone strong. Because of this process, called remodeling, where osteoclasts break down bone and osteoblasts build bones, the bones that you have now are not the same bones that you had 7 to 10 years ago, and they will not be the same bones you will have in 7 to 10 years from now. This gives you the possibility of improving your bones. In healthy bones, the osteoclast and osteoblast activity is balanced. When bone remodeling becomes unbalanced, bones become thin and fragile. Another way to think of this process is when bone removal happens faster than bone replacement. The bone remodeling process we just learned about also changes as you age. This is the life cycle of the skeleton. At the beginning of life, a baby grows rapidly, including their bones. Throughout childhood, the bone-forming osteoblast cells are working faster than the breaking down osteoclast cells. However, at around age 10, the skeleton grows very rapidly until about age 20. This period is referred to as a person's peak bone building years. This is the time to build as much bone as possible. Peak bone mass is achieved at around age 30 for both men and women. After reaching peak bone mass, osteoblast and osteoclast activity is working at the same pace, and bone mass stays relatively stable until menopause for women and at around age 70 for men. This is the time to maintain as much bone as possible. At menopause, because of the decrease in estrogen, the osteoblasts do not keep up with the osteoclasts, and there's a rapid period of bone loss. During the 5 years around menopause, women can lose as much as 15 to 20% of their bone mass. The average age of natural menopause is 51. Some women may go through menopause earlier in life due to surgery or medical treatments and are subject to the same bone loss issues as women with natural menopause. This is the time when women want to prevent bone loss. Men will also want to prevent bone loss at this time. However, men continue to lose bone density at a steady and slower rate than women. At about age 70, the reduction in men's hormone levels begins to cause more rapid bone loss for them. At this time, men and women tend to lose bone at the same pace. Understanding the life cycle of the skeleton helps us to understand how we can prevent weakened bones, osteoporosis, and fractures. Please be sure to download the handout called Healthy Bones, the Foundation of Healthy Bones, so you can reference this information in the future. Now, as you heard earlier, having one fracture due to weakened bones, which is referred to as a fragility fracture, puts you at a high risk of having another fracture. When your bones are weak, they break easily by just bumping into something or falling. Often the first break is a wrist fracture from falling. The most common bones that break during osteoporosis, in addition to the wrist, are the upper arm near the shoulder, the hip, and spine bones. Remember, bones should not break when you fall from a standing height. Unlike other bones, sometimes a fracture in the spine goes unnoticed. Other times it is accompanied by much pain. If you have had a loss of an inch or more of height within a year, it may be a sign of fractures in your spine. You can't feel your bones getting weaker, so it's important to know what your risk factors are for making them weak. So let's review some risk factors for weakened bones and fractures. The purpose of this slide is to identify some of the risk factors for bone loss that cannot be changed. There are many risk factors for bone loss and fractures, some which you cannot change and some which you can. The factors you cannot change are gender. 80% of people who have osteoporosis are women. Women have a higher risk of osteoporosis than men due to low estrogen levels as they age. Genetics. About 60% of bone health can be attributed to genetics. If your mother or father had osteoporosis, you're at a higher risk yourself. Age. As we age, our risk increases. This is called primary osteoporosis or age-related osteoporosis. Fracture history, both yours or your parents. If you have a low impact fracture, your chance of having another fracture increases. And then finally, medical conditions and medicines. There are a number of medical conditions and medicines that can affect your bones, such as HIV and some of its treatments. We will review a list of the most common in a few minutes. And again, we can't do too much about these risk factors, but it's important to be aware of them to minimize impacts. We also have a handout available for download titled Osteoporosis, Taking Charge of Your Bone Health. Now, the purpose of this slide is to identify some of the risk factors for bone loss that can be changed. The great news is that there are a handful of factors that you may be able to change. Those risk factors you can change right now are making sure that you're getting the right amounts of calcium and vitamin D, eating 3 to 4 servings of calcium-rich foods a day, not smoking or vaping, limiting alcohol to 1 or 2 drinks a day, getting adequate physical activity, especially weight-bearing activity and weight-bearing exercises, improving your posture, doing what you can to make sure your body weight is appropriate, and talking with your healthcare providers about the medicines you take. There are many medical conditions and the medicines to treat them that can lead to bone loss. This is a list of the most common conditions that can cause bone loss and increase fracture risk. I will not read them, but take a minute to review the list. If you know that you have any of these conditions, be sure to have a discussion with your healthcare provider about them. There's a link available to an informative article called Tests to Determine Secondary Causes of Bone Loss. Now, there are also many medicines that can cause bone loss. This list is just a snapshot. Please take a moment again to review the list. We also have another handout available titled Medicines That Can Cause Bone Loss, and we have made this available for your reference. If you are taking any medicines currently, or starting a new medicine, be sure to consult with your healthcare provider about its effects on your bone health. Now, having healthy bones is an important part of your overall health and wellness. The choices you make can affect your bone health as you age, so keep your bones in mind as you make healthcare decisions with your doctor. Your primary care physician is a great place to start your journey towards managing your bone health, and it's great to go into your appointment with knowledge to discuss your bone health with your healthcare provider. Now that you know the risk factors for weakened bones and fractures, what should you do? Well, it's important to understand what caused your bone to break. If you had a break from a low trauma event, you want to talk to your healthcare provider about what you can do to protect and keep your bones strong. If you have broken a bone since your last primary care visit, be sure to tell your physician, as they may not have been involved in treating your broken bone or even aware that you had a broken bone. So ask for a bone mineral density test if you have not had one since you had your fracture. Ask if you're getting enough calcium and vitamin D. Your healthcare provider may do a simple blood test to check your levels. If levels are low, your doctor may discuss supplementing calcium and vitamin D. Be aware of any exercises or physical activities that you should avoid to lessen the risk of future fractures. And discuss whether a bone strengthening medicine is appropriate for you. We'd also like you to please download the handout titled Talking with Your Healthcare Provider. This is a worksheet to help you ask the most appropriate questions with the time you have with the healthcare provider. We also have a link to an article called How to Talk with a Healthcare Provider, giving more tips on this topic. You can access the handout and link at any time in the Files section. Now, we just discussed the importance of having a bone mineral density test if you had a fracture. If you haven't had one, you may be wondering what it is. The gold standard for screening and diagnosis of osteoporosis is called DEXA. This is short for X-ray technology called dual energy X-ray absorptiometry. Sometimes a DEXA is also referred to as a bone mineral density test or bone density test. This test measures the amount of bone density, usually in the spine and hip. It is simple and painless and takes about 15 minutes. As long as you're not wearing any metal, such as a zipper or underwire bra, you can keep your clothes on. You will need to lie still, face up on a padded table as the arm of the scanner passes over you. The scanner uses a very small X-ray beam to capture images of the bone in your lower spine and hip. It uses about 1/10 of the radiation of a chest X-ray. That's less radiation than you'd be exposed to on a coast-to-coast flight. Now, while a DEXA is used to diagnose osteoporosis, your healthcare provider will also use DEXA scans to help monitor your bone health after a fracture and to help determine your future fracture risk. Now, when you get a bone density test, the results are reported as a T-score. That's a statistical measurement. The T-score tells you how your bone compares to a healthy person at peak bone mass around age 30. A Z-score compares your bone density to the average bone density of people your own age and gender. Now, a T-score is reported as a standard deviation, which tells you again how far you are from zero. A standard deviation is 10% and is used to describe the ranges for many tests. If a T-score is between -1 or greater, it is classified as normal bone density. If a T-score is between -1 and -2.5, it is classified as low bone density, also known as osteopenia. If a T-score is negative 2.5 or lower, then it is classified as osteoporosis. Bone density is only one part of your bone health picture. If you have broken a bone and have a T-score that indicates low bone density, you can still be at increased risk for future fractures. It is really important to ask for and keep a copy of your bone density tests. You will want to be able to compare your results when you have follow-up tests, and if possible, take follow-up DEXA tests on the same machine. Take your DEXA results with you to each doctor's visit. There is also an additional software program called TBS, or Trabecular Bone Score, that is available on some DEXA machines that gives a reading of bone quality or bone strength. You can ask the facility that performs your test if it has TBS software and find out if you need additional written prescription from your physician. An important part of taking care of bones is talking to a healthcare provider about what can be done to protect and keep bones strong. Healthcare providers will discuss your DEXA results, review your fracture risk, and help develop a bone health management plan that fits your lifestyle. Your primary care provider or bone health specialist will also help to determine whether a bone medicine is appropriate and will monitor your ongoing bone health. Sometimes your primary care provider will refer you to a specialist, depending on your bone health. Not all primary care providers will be comfortable treating your bone health issues, and that's okay. It is also okay for you to advocate for yourself and ask for a referral to a bone health specialist. Now, let's look at what type of healthcare provider and treatment is right for you to manage your bone health. Now that you understand that you need to work with a healthcare provider to manage your bone health, let's cover who manages a broken bone and who manages osteoporosis, a chronic condition that leads to broken bones. You most likely saw an orthopedist or an orthopedic surgeon for your broken bone. They fix the break and ensure the bone heals. They may have ordered a bone density test and helped coordinate follow-up care with other specialists you see on this slide. They do not typically manage long-term bone health and medicine. Therefore, it's important for you to talk with your primary care provider or a bone health specialist for long-term bone health plans. Your primary care provider or bone health specialist will help you understand the root cause of the break and weakened bones and to manage and monitor bone health long-term. You may also see an occupational therapist, a physical therapist, or even a registered dietitian as part of your follow-up. So, where do you go if you need to find a bone health specialist and haven't been referred to one? There is no one specialty that treats osteoporosis and bone health. When considering the specialists listed on the chart, search for those providers that specialize or have an interest in osteoporosis or bone health. So let's take a moment and run through these specialty areas. An endocrinologist specializes in hormone-related conditions, which can often affect other parts of your body. They can diagnose and treat osteoporosis after a fracture and will often conduct testing to look at hormone levels and see if this is influencing your low bone density. A rheumatologist specializes in treating musculoskeletal diseases such as arthritis and inflammation throughout the body, as well as other diseases of the bones, joints, and muscles. Geriatricians specialize in caring for all aspects of health in older people and may specialize in bone health. Gynecologists specialize in diagnosing and treating conditions of the reproductive system of women and may specialize in bone health. Physiatrist is a specialist in the physical medicine and rehabilitation field and are healthcare providers who have gone through medical school and have completed training in the specialty of physical medicine and rehabilitation. This is a branch of medicine that is dedicated to the diagnosis, prevention, and treatment of all types of disabilities related to the brain, nerves, bones, and muscles. They can diagnose, design treatment protocols, and prescribe medicines. Some internal medicine, primary care, physician assistant, or nurse practitioner providers specialize in bone health conditions. Academic medical hospitals or centers, which are medical schools affiliated with a hospital, can often have specialized bone health departments or even bone health clinics where there is research being done. At an academic medical center, education, research, and clinical care are combined to provide the best possible clinical care that uses cutting-edge technologies, resources, and therapies other community hospitals may not have available. When you find a healthcare provider that specializes in osteoporosis and bone health, they will want to try to understand why your bones are weak and see if there may be an underlying cause that can be managed. Now, you may be referred to a movement or exercise specialist as part of your bone health plan. If you need to find them on your own, search for providers that specialize or have an interest in osteoporosis or bone health. So let's also take a moment and run through these specialty areas. Physical therapists are movement experts and can evaluate your balance and gait. Finding a therapist that specializes in bone health issues is well worth the research, as they can help you develop an exercise plan specific to your needs. Occupational therapists can help you safely perform activities of daily living to avoid future fractures. Exercise physiologists develop fitness and exercise programs that help patients recover from chronic diseases and improve cardiovascular function, body composition, and flexibility. Exercise physiologists typically need at least a bachelor's degree in exercise physiology, exercise science, kinesiology, or another healthcare and related field. Master's degree programs are also available, and degree programs in exercise physiology, exercise science, and kinesiology are accredited by the Commission on Accreditation of Allied Healthcare Education Programs. These programs usually include courses in science and health-related subjects such as biology, anatomy, statistics, kinesiology, and nutrition, as well as clinical work. Physiatrist was described on the previous slide. It is included on this slide as well because this type of specialty may also be sought out as an alternative to surgery when surgery may not be appropriate, or as an alternative to more invasive solutions. They are concerned with the disease effects on body systems such as muscle and bone, and improving overall everyday functioning such as dexterity and mobility. Exercise is usually an important part of your bone health plan, so you want to be sure to look for programs or specialists that understand safe movements for people with osteoporosis. There's an additional handout that is titled Exercises for Bone Health. If your healthcare provider recommends a bone medicine, there are many types of osteoporosis treatments available. They have all gone through rigorous testing, have been approved by the FDA, require a prescription, and have been shown to significantly reduce the risk of fractures. These medicines work by three actions: anti-resorptive, which means they slow the rate that your body breaks down bone. Anabolic, which increase the amount of bone formation. And dual action, meaning that the rate of bone being broken down is slowed and there is an increase in new bone formation. Finding the treatment that is right for you will be based on how high your fracture risk is and what form of treatment is most convenient for you. There are 3 types or different types of delivery methods, and they are pills, injections, and infusions. All osteoporosis medicines need adequate calcium and vitamin D to be effective. If taking bone medicine is recommended, it's important to talk to your healthcare provider about what osteoporosis medicine may be right for you. Conversations with a healthcare provider will be different from person to person, but these are some general questions to keep in mind. Some questions you might think to ask are, what medicine is best for me and why? How should the medicine be taken? Pill, injection at home, injection given by a healthcare provider? Are there any possible side effects from the medicine? Are there any possible risks if I don't take the medicine? How will I be monitored while taking the medicine? And then what is the cost of the medicine and will it be covered by my insurance? So what can you do to manage your bone health and prevent the risk of another fracture? Even if your healthcare provider has prescribed a medicine, it's important that you take other steps as well. This includes eat a bone healthy diet, be active, and prevent falls by taking steps to improve your balance, strength, and adjusting your living environment. Make sure to work with a healthcare provider to determine the best course of action. We have posted the handout Talking with Your Healthcare Provider About Bone Health to prepare you to discuss the bone health plan at your next appointment. So let's review what a bone health diet looks like. Calcium is very important, but not only for your bones. In addition to building bones and keeping them healthy, calcium enables our blood to clot, our muscles to contract, and our heart to beat. If your body does not find enough calcium in the blood for those functions, important functions, the body will take calcium from the bones to maintain normal levels. So consume about 1,000 to 1,300 milligrams of calcium every day, preferably from food. Vitamin D is needed for the body to absorb calcium. Our bodies manufacture vitamin D when the skin is exposed to sunlight. But if you wear sunscreen, your body may not be producing vitamin D. Most people need to take a supplement to maintain a normal vitamin D level. Eat a balanced diet of whole foods to get all of your bone healthy nutrients. There's information on our website about bone health nutrients that covers getting calcium, vitamin D, magnesium, and other bone healthy nutrients into your diet. Get sufficient protein. As we get older, it is harder for our bodies to process protein efficiently, but protein is important to maintain muscle mass. So aim for 5.5 to 6.5 ounces per day. Reduce your salt intake as it can leach calcium from your bones. Limit alcohol consumption for your bone health and overall well-being. Eliminate smoking. Bone health and Osteoporosis Foundation's signature program, Eating for Healthy Bones, is devoted to this topic. So please check the website for upcoming events. Now, once the fracture is healed, the next step is to be active. It is important to consult with a physical therapist or other provider who has expertise in post-osteoporotic fracture rehabilitation and can develop a specific plan tailored to your needs. Safe movement modifications and precautions may need to be taken to avoid additional fractures. Do weight bearing and muscle strengthening activities, especially for your legs. Focus on posture and good body mechanics, and improve your balance. There is information on the Bone Health and Osteoporosis Foundation website about movement and exercise that shows you what specific activities you can add to your routine that will improve your overall muscle strength and improve balance. When you do that, you can reduce your risk of falling and fracturing a bone. You can share these exercises with your physical therapist to ensure they provide appropriate activities for you. Join us also for another presentation called Posture Power, which covers postural alignment for everyday movements, sports, and exercise to reduce your risk for a fracture. And take steps to prevent falls by making sure your home is safe and implement actions that will make a fall and fracture less likely. You can make your home safe by removing clutter and trip hazards, especially throw rugs. You can stay current on vision checkups. Not being able to see clearly can lead to trips and falls. Use night lights, handrails, and grab bars as needed around the house. Be mindful in activities by paying attention to what you're doing. Many falls are a result of inattention, getting distracted, and letting your mind wander, or multitasking, such as texting while walking. Train your muscles and improve your balance through progressive impact exercises and balance exercises. The Bone Health and Osteoporosis Foundation's signature program, Stepping Out Strong, covers fall prevention. This entire program focuses on fall prevention and provides simple, everyday exercises to strengthen muscles and improve balance. Again, please check the website for an upcoming event. And be sure to download the brochure in the files section called You Had a Fracture, Now What? Your Guide to Bone Health After a Fracture. It contains helpful post-fracture tips to help after a fracture. Now, we covered a lot about bone health today, so it's important to remember a fracture is a sign that your bones may be weak. Having one fracture that is due to weakened bones, which is referred to as a fragility fracture, puts you at a high risk of having another fracture. This risk is especially high in the first 2 years following a fracture. It is important to understand all your risk factors so you can take steps to reduce those risks. An important part of taking care of your bones is talking to your healthcare provider about what you can do to protect and keep your bones strong. It's also important to talk to your healthcare provider once you've broken a bone. Lifestyle changes like exercise and proper nutrition can help prevent falls and fractures. So stay in touch for the most up-to-date information by signing up for the newsletter, connecting with us on Facebook or Instagram, or emailing info@bonehealthandosteoporosis.org. As part of a bone health plan, we recommend everyone know their fracture risk. To determine your personal fracture risk, go to the link provided. And we want to thank you for watching this program. We want to also please ask you to please help end fractures and osteoporosis as a major public health program. Again, we here at the Bone Health Osteoporosis Foundation thank you for your attendance today. Now, I'm happy to answer any questions now. And so if you have any questions that have not been submitted, please submit them now. Thank you, Anne. I want to open it up for you to address any questions that we still can answer today.
Sure. Thank you so much, Kathleen. That was a terrific presentation and you covered a lot of information. So we do have some questions. Someone asks, I have severe osteoporosis, had a T4 fracture in February, didn't want to take Prolia, but decided to start Fosamax. Now, 2 weeks ago, had an acute flare-up of my lumbar, also have osteoarthritis. They say they take calcium and eat healthy. Can they get better?
Yeah, again, this is a great conversation to go back to your physician as well, because some medications, again, as we saw before, work to help us build bone, and they can also have a role in helping to repair bone. And so if you feel like you're still having issues, it's normal also to have multiple conditions with our bones in our spine. So we can have osteoporosis, we can have arthritis. There can also be other conditions called stenosis or spondylosis, which are more versions of arthritis of the spine. And so to go back, don't wait for your next follow-up visit. If you're having pain, I encourage you to go back to your physician and let them know that you have been compliant with the medications as prescribed. But if they're not giving you the relief and raising your concern, I think it's definitely worth a conversation about should you reconsider medications. And again, just making sure that you have appropriate nutrients involved in place to support those medications having the greatest impact. And anytime there's any pain involved, I encourage you to ask your physician for referral to a physical therapist, especially trained in the area of osteoporosis management, so they can help you with maybe even some exercises that could help with the pain and promote some movement, which may also help with the bone healing.
Great suggestion. Just to further that, I'd like to point out you had mentioned you have osteoarthritis. One of our partner organizations called the Arthritis Foundation, they have great information about osteoarthritis, and we'll go ahead and put a link in the chat if you'd like to take a look at their website. They also offer some great educational webinars that are free that you can attend as well. So if you are someone with arthritis, that would be a great place to check out. So someone, Karen, asked a question, is a T, well, she says, is an S score important after 67? I believe she probably means a T score.
A T-score. So yeah, we talked about two different scores. The T-score helps with diagnosis and monitoring change over time. But that is, again, a T-score, as we indicated before, is kind of comparison to maybe what we had when we were in our 30s, right? A Z-score is a comparison to your age and gender related norms. So compared to other women my age, how am I doing? And it is important even at any age, and they will continue to use that score to help monitor changes.
Sandra asks, I've been diagnosed with osteoporosis and received treatment. In the past week, I have intermittent metatarsalia, I believe. I'm not saying that right. In the first two toes of the right foot only.
Yeah.
About 2 years ago, I had a break in a small toe on the same foot, but it's healed. This pain is idiopathic. what could cause this. They
Yeah.
say they enjoyed regular exercise, including weight bearing. Uh, so she's asking, what do you recommend? And have you ever heard of this intermittent dull pain in the toes? And she is on a drug holiday from Boniva as recommended by her
Yeah. So
endocrinologist.
okay. So excellent. Yeah, metatarsalgia is just basically a condition of pain in the feet, and it usually can be related to the bones. It can also be related to some of the structures that support the foot and the bones. And unfortunately, as we age too, sometimes we will lose some of that muscle strength. Remember, we talked about how both the muscles and the bones have a strong role in supporting each other. And so sometimes if there is that loss in that muscle integrity and strength and that supports the arch of our foot, a podiatrist might be a good referral because of the fact that they are making sure that maybe your shoes have appropriate orthotic support in order to give support both to the bones that maybe are needing a little healing and to the muscles that maybe have lost their structural strength or integrity. And this obviously impacts doing some weight bearing exercises possibly. So this would be, again, another opportunity to get a referral to a physical therapist that might be able to teach you some modifications to exercises so that you can also continue to do resistive training exercises that can help strengthen more proximal bones while the foot is healing so that you can then gradually progress towards weight bearing exercises. So boy, I tell you, that pain in the feet can be very disabling, and you don't want to, be sitting with that foot elevated, waiting on it to heal. So I encourage you to maybe seek out those two resources for that support so you can keep moving forward on improving your bone health and controlling the pain.
That's a great suggestion. Thank you. Um, we get this question quite a bit. It's very hard to find a provider who is knowledgeable about osteoporosis. What can BHOF do to provide classes and programs for providers?
Yeah.
So,
Well, I will say the Bone Health Osteoporosis Foundation has done a wonderful job in partnering up with an organization with Osteoporosis Canada and bringing a program called Bone Fit. And of course, I'm thinking from the perspective of a physical therapist, because often we're trying to get people aligned with classes that are appropriate, and those instructors are well aware. And so Bone Fit is a program that trains both physical therapists and specialists, endocrinologists, anybody that is a healthcare provider, as well as training fitness instructors on appropriate exercise for people with low bone density. And so there is a link on the Bone Health and Osteoporosis Foundation website to that program, and also a locator where you can find people in your area that have gone through this training. And if they haven't gone through the training and there's a class that you like to go to, I encourage you to ask that instructor or that clinician, would you consider taking this training? And here's a link that I found, because I would feel more comfortable knowing that you have the knowledge to really address my care and needs. So I think it's a wonderful program. I've been through that training and I've hosted that training. So I would count on that as a resource.
well, thank you so much, Kathleen. That's a great firsthand recommendation. I went ahead and put the link to find a bone fit professional in the chat, so you can take a look at that. Let's see here. Oh, the person that asked about the S score was actually a Z score.
These
So,
Yeah, and
and
personally, I don't hear the Z-score being provided as much. Sometimes I heard it provided more in younger people, and they were really wanting to say is like because we always associate osteoporosis with aging, but there have been young runners and young athletes that unfortunately maybe due to different conditions with their eating or their hormone balance because of the intensity of their training, They have had, even fractures young due to low bone density. So that's oftentimes sometimes where you hear the Z-score used more often. But the T-score typically, as we reach at least 65 and older, is used both for providing a diagnosis and for monitoring the effectiveness of intervention.
Uh, what would you recommend, Kathleen? Who is the best healthcare provider for spondylitis or stenosis or kyphosis of the spine?
Yeah. Okay. Well, I might be biased, but
Mhm.
again, I'm going to say a physical therapist that's especially trained in osteoporosis when you're talking about exercise intervention for those conditions. Now, obviously, an orthopedist, especially one that is a specialty in the spine, will help with the proper diagnosis and the degree of involvement. And as a physical therapist, sometimes it's valuable for us to hear or read the results of maybe some imaging that was done, and that might help us a little bit in our plan. We're still going to do a thorough evaluation, but therein lies, the challenge that we have. We do know that with osteoporosis, we want to avoid, especially when we're talking about the spine, loaded or excessive in-range trunk flexion or forward bending. But with some of those conditions that you listed, sometimes that's what's suggested, that we do flexion of the spine to relieve or open up or gap that area in the spine that may be painful. So as a physical therapist, what we have to do is find out, how do we still provide that sort of gapping or opening without putting in excessive flexion? So that is especially why I would encourage you first to go someone that is trained in that area in physical therapy to give you that guidance and education. And then you can take that knowledge into your own home exercise program or your fitness center and apply that with just the challenges of having multiple conditions.
Okay, let's see. We have just a few more minutes. Someone is asking about a program called Wellen. I am not
Huh?
familiar with it. Are you?
Yeah. No, I'm familiar with Wellen. I think it's well done. They actually did seek consult from, many qualified practitioners. They also gave me the opportunity to kind of review their program. It is basically an online application of specific exercises for people with osteoporosis. They do a really nice job that when you sign up or subscribe to it, they take you through a little mini assessment. And based on that, if you're having any issues with pain or discomfort, they're going to kind of guide you to suggest that you go visit with a physical therapist first. But then based on your performance, they then make a very individualized exercise program. And you will get a link on your phone as often as you want, but sometimes even daily, where you will link on it and it'll guide you through your exercises for the day, which can often be done under 20 to 30 minutes at the most. And it does everything from addressing the spine to legs. And I'm really impressed with the efforts and the work that they put behind developing that program. And I think it's a nice program.
And how do you spell that program? Is it
Wellen,
Wellen?
it's
Mhm.
Wellen.
Okay, thank you. Um, what, in your opinion, Kathleen, someone's asking, what is the top weight-bearing exercise you suggest for osteoporosis?
Well, first of all, it's the one that you'll do,
Mhm.
right? And it's the one that I'd have to say one of my very favorite exercises to give people are chair squats or body weight squats, and even progressing that to weighted squats. When I see a client in the clinic, the first thing that we do after an evaluation is we talk about the foundational principles of exercise, what we should avoid, what we should be mindful of, and we work on proper form and control. But what do we do every day? We get up and out of chairs, up and off of commodes, up and off out of the sofa, things of that sort. We squat down to put the leash on the dog. We want to get up and down to garden. So a chair squat or a squat exercise, I think, is a really good first weight bearing exercise to do because it teaches you proper form and control. And then you can talk about appropriately loading it to meet what your demands are. So I'd have to say that's one of my very favorite ones. But the most important exercise is the one that you will enjoy and that you will do, and you can do well with good form.
Great. And then we're at time here, but I wanted to, someone asked about remineralize bones once they have, can you remineralize bones once they have been demineralized?
Yeah, I mean, great question.
Yeah.
A lot of it has to do with one, your age, two, yes, the nutrition that you're taking in, and three, depending on your desire, some of the medications helped you to sort of fortify that bone through those efforts through mineralization. And if you're concerned at all, I mean, obviously that is an area if you think you have some deficiencies due to thyroid conditions or whatnot, that's a great area to or opportunity to have a referral to an endocrinologist that takes a deeper dive, sometimes into the a panel that will look at the conditions influencing maybe that proper mineralization and balance.
And then there's one more question, and we can go ahead and wrap it up. Is standing Pilates exercises on a machine safe for severe osteoporosis?
That's a great question, too. I think Pilates is a wonderful exercise form. That is where, again, I would encourage that your Pilates instructor has been through, has some awareness and or training in osteoporosis management. A lot of it depends, again, on your ability to maintain good alignment and form as you're doing those exercises. And so whether it's on the mat or whether it's on a reformer, a lot of it is about your ability to maintain good form and control.
So we're at time. I wanted to mention there was quite a few questions about medications and what to do about medications and what they are. I put a link in the chat that shows our upcoming events. There is two programs coming up in the very near future being presented by professional doctors and healthcare providers that are knowledgeable about medication. So please check those programs out, and you can register following the link that's in the chat. But I thank everyone for being here today. Thank you so much, Kathleen, for your tips and suggestions and helpful comments. We really
Yeah, my
appreciate
pleasure.
your expertise, certainly.
Yeah.
Um, and I think that's it. So just as a reminder, tomorrow you'll receive a follow-up with all the links and resources we've talked about, as well as the replay link. So thank you very much.
Thank you, Anne.
Thank you. Bye. Take care.